There's Miss Percy.
That's Miss Stevens.
And Miss Stevens and Mr. Williams here for Latasha's first speech.
Okay.
Maybe. Good afternoon. My name is Latasha Williams, and I'm going to be talking to you today about an age-related disease that causes memory loss, mental confusion, and later permanent loss of memory. Over 5 million Americans suffer from this disease. It is the sixth leading killer. It permanently affects the brain, and it does not affect children. You may be thinking to yourself, why do I need to know this information? Well, we're all growing older, and we can all develop this disease. After researching and having both of my grandparents suffer from Alzheimer's disease, I would like to share with you some of the knowledge that I have learned. The National Institute of Health financed a study. This study was called Preventing Alzheimer's Disease and Having Cognitive Decline. The panel discovered that combating diabetes, stopping smoking, treating depression, and exercising regularly and having intellectual activity helps reduce the risk of developing this disease. In the beginning stages, a victim may have difficulty remembering their names and recent events. Later, behavior changes, impaired judgment, trouble walking, talking, eating, and swallowing may occur, and you may forget your daily routine. High blood pressure and cholesterol, head injuries, Down syndrome, and genetics can play a factor. The cost for care for this disease can be very expensive. Medicaid and Medicare does not cover all of the costs of the care that you would need. Many have to pay out of pocket for personal expenses, in-home care, nursing homes, assisted living, and just having someone to watch you. Sometimes you may need a sitter to come in. I have personally experienced this from my grandparents, where my mom tried to take care of both of them, and it was very hard because they need 24-hour care. Sometimes I remember my grandmother would forget to sleep, and so she would be up at night, so she would need care in the middle of the night. So it was an ongoing thing. Um, I remember my grandmother being very combative, forgetting who we were, and that was very difficult for my mom. March of 2010, the Affordable Care Act became the law, and with this law, insurance companies are paying for more expenses related to Alzheimer's disease, but they don't cover 100% of the costs. A lot of times you have personal needs and other conditions related to having Alzheimer's disease. As I mentioned earlier, you have trouble remembering how to walk and talk, so those symptoms can cause injuries like falling, which is very common with Alzheimer's patients. Um, Sometimes you have trouble having an appetite when you have Alzheimer's disease, and so you may have to have a nutrition to help give you an extra nutritional meal so that you can replace the meals that you're missing. Um, there is no one reason for having or developing Alzheimer's disease. There's lots of research to help intervention and enhancing the quality of life. I believe the most reasonable stance is to live your life like you can develop Alzheimer's disease and take better care of yourself to help minimize the risk of developing this disease. Thank you.